Well, now that you've learned about the human body and all its intricacies and web-like connections, how do you put it all together in a usable format to help you figure out what's going on with your patient that's making them ill? You start with a functional medicine matrix and do a timeline. This is history taking done right and becomes the ultimate patient empowerment tool. History taking should be part of every clinician's best practice because it's how we get to the root problems that cause illness. By figuring out when and where it started, antecedents, and what may have triggered the illness, and treat what is perpetuating or mediating it. These are known as ATMs, antecedents, triggers, and mediators. Discovering these can help point us in the right direction as to the best treatment course of action. But getting the patient to be compliant with lifestyle changes and dietary changes can be a huge challenge. When we do a timeline, we are engaging the client to think back over their entire lifetime and realize key things that may have happened to them, or instances that may have triggered or exacerbated their illness. A never well sense moment. This helps build a bond with the patient, and the patient then becomes involved with their own healing journey, which can be very, very empowering. Most patients are clueless as to the cause or causes of their illness. But when they see sometimes multifactorial key events that have contributed to their state of health, delineated in a timeline, research suggests patients will be more engaged in treatment plans when history taking is patient-centered and individualized. That's what functional nutrition is all about. During initial visit, numerous questions are asked about the patient's lifelong medical history, as well as diet, emotional state, and key events, which are plotted out on this timeline, from preconception to present day. You're looking for triggers of key complaints and events that left the person sensing they were never well since the event happened. The timeline helps the patient and the practitioner uncover these ATMs as having a root cause in their illness. For instance, Peggy's asthma could be caused by childhood antibiotic use, leading to gut dysbiosis, triggering gut inflammation, triggering leaky gut, perpetuating food allergies and sensitivities, which lead to irritable bowel syndrome. The inflammation then triggers insulin resistance, the buildup of adipose tissue around the organs, or central obesity, which then perpetuates insulin resistance syndrome that leads to metabolic disease or diabetes and weight gain issues. When diving into the timeline with Peggy, it became apparent to me that Peggy's lungs got bad when her gut was bad. When laid out on the timeline, it's like watching the dominoes fall. Both IBS and asthma are inflammatory conditions. So I realized that the root cause of her asthma was a lifelong inflammatory gut problem. After treating the gut issues, healing and sealing the gut lining of the small intestines, and improving digestion and the microbiome balance of good bacteria, her asthma disappeared. Now here is where functional specialty lab testing becomes handy. We need to find out what exactly is going on in the gut to cause inflammation. You'll have at your disposal a functional nutrition toolbox of specialty lab tests to help you determine the root cause of your patient chronic illness, along with treatment protocols, lifestyle and dietary plans for the most difficult cases: autoimmune, SIBO, candida, dysbiosis, gut disorders, allergies, and weight issues, and what foods to avoid. You'll be given the option to self-order lab tests at a discount when you become a member and have ordered the Mastering Functional Nutrition course. I'll teach you what lab tests to order and how to interpret your own labs, but only in the United States. So don't miss this important lesson.